Okay, let's bring in now Dr. Sandeep Vohr, psychiatrist, who's joining us on this broadcast. Good evening, Dr. Vohr. Thank you for your time. There's a lot of back and forth, a lot of confusion, and of course, a whole lot of hearsay about what exactly schizophrenia is. So, Dr. Vohr, first of all, if you could just tell us what schizophrenia is and what are the kind of symptoms a person or a patient will face.
Okay, Akshita, it's very important for us to understand the mental health issues, and this is a way in which we can understand how things can go so bad and sad. Schizophrenia is a mental disorder in which there is false perception and there are hallucinations, and the person tends to perceive things which are not meant that way, and person starts imagining things which are not the facts. Person tends to be in a delusional state. They tend to have voices in which they listen to the voices. The voices are either commenting on them or are giving instructions or giving them a running commentary. And they are, there is a break from reality in which they do not understand the normal day-to-day activities and they misinterpret in a very different way. So what schizophrenia is a mental disorder. And of course, it is treatable if the treatment is given at the right time and it is continuously given and regularly the medicines are taken by the patient.
Dr. Vohr, in connection with this particular case, is schizophrenia treatable? And the reason I ask this is because what we know in this case is that the accused, the wife Pallavi, was undergoing treatment for the last 12, 13 years. So if you're under medication, does it mean the symptoms are under control? Does that mean that you don't hallucinate?
Yeah. So when I say it is treatable, that means that you can say around 60 to 70% tend to recover completely on medication, but around 30% of cases, besides the treatment, that symptoms tend to either stay or there is waxing or waning of symptoms. Many times what happens, the patients tend to recover, but the patient either tends to stop medicines, or many times there are other issues involved in which the medicines are not given or not taken by the patient. So schizophrenia is treatable, but in some of the cases, there could be active psychopathology, whether it is despite regular medication or whether it is because of inadequate compliance, that varies from case to case. In this case, of course, the treating psychiatrist can exactly tell us the exact diagnosis as well as the reason for the acute exacerbation if it was, as claimed by the son, who says that she has been undergoing treatment for schizophrenia.
Dr. Vohr, in such a case, considering that she was undergoing treatment for the last 12, 13 years, can there actually be a trigger? What led to, her going ahead and taking on her husband, claiming that, she was being attacked in this manner, if, of course, she's found guilty of the crime?
So, Akshita, there are various types of schizophrenia, and one of the commonest types is paranoid schizophrenia, which exactly behaves like this, the way you have said, the WhatsApp messages which you have shared. Usually the patient tends to go into a paranoid thought process in which whatever is happening around them, they tend to, misinterpret it as being done against them. For example, if the Swiggy or Zomato person comes and gives them the, routine, like any other case, they deliver the food, they will be misinterpreting it. If somebody is putting normally a routine salt or sugar in the food, they will feel that it is being deliberately done. So if somebody is going and they are just talking amongst themselves, the patient starts feeling that, they are being talked about, or they start getting referential ideas. So the whole thought process of a normal activity is, misunderstood and misinterpreted by the patient. The fact that she has written that I was under constant surveillance, as a psychiatrist, we always see that the caregivers are many times at the receiving end because they try to take care of the patient, and that is interpreted by somebody who is in a paranoid realm that, this person is constantly under, I'm under surveillance because this person is constantly looking after what I'm doing. The fact is that the caregiver is trying to help the patient. So what led, and yes, you asked me what could be the reason for exacerbation or precipitation. Many times what happens, there is a stressor, there could be a fight, there could be an argument, or sometimes the patients are otherwise okay, but they tend to stop the medicine, which leads to acute exacerbation in which the psychopathology comes out in the open. So the WhatsApp messages which you are showing are actually, they are akin to anybody who has acute psychopathology of paranoid spectrum, paranoid schizophrenia. They actually do like this. They send the messages and they write like this or they behave like this. But the fact, whatever the fact is, only a treating psychiatrist can tell you.
Okay, so of course we'll have to wait for investigation, but I also would like to understand here, Dr. Vohr, looking at the circumstances of this case, if indeed she had hallucinated that her husband is after her life, adulterating her food, threatening her with a gun, how does that really hold up in a court, the fact that she believed that she acted in self-defense?
Actually, that will depend on what was the problem, what was her mental state at the time of act. So that will depend on whatever proof is given, whatever, prescriptions or whatever, treatment history, if we have, based on that only we can analyze. And if somebody has done something, it is very difficult to prove whether it was something pre-planned or it was actually she was responding to her misinterpretation. It's very difficult to prove. So that will depend on what was her actual psychopathology, which can be actually analyzed by, in such a case, usually a panel is made of psychiatrists. They examine the patient and then they give their report. Based on that report, of course, when it comes in front of the judge, they will take a call to, exactly decide her degree of involvement in all this.
Dr. Vohr, my final question to you is, in this case, it wasn't an undiagnosed case of schizophrenia. It seems to be diagnosed. She was undergoing treatment. And in such a circumstance, is a schizophrenic patient actually capable of murder? And in this case, should she not have been at her residence if she was hallucinating to this level?
Absolutely. You are very right. If she was having acute exacerbation, she should have been under constant care and she should have been admitted. But we don't know the facts, whether it was a continuous illness, whether it was suddenly, it came up within few hours, few days. What was it? We don't know. That is the reason I'm saying. But yes, in a case like this, when the patient is either threat to himself or herself or to others, the patient is always advised admission and we go for treatment on emergency basis in which we give injectables and many times for certain other modalities can be used, for example, modified ECT. So that is the treatment modalities are there. But whenever there is somebody who has acute, homicidal or suicidal threat, if it's given, then all the psychiatrists tend to, give the advice to the family to get the patient admitted immediately to avoid this in such unfortunate incidents which happened in this case.
It's unfortunate, truly. From what you're telling me, Dr. Vohr, if she did indeed kill her husband, it was clearly because of a lack of necessary care as well, that if she received the necessary treatment, maybe this could have been avoided altogether. Dr. Vohr, thank you very much for joining us.